to thrive in. Our event today specifically addresses some concern about questions about the COVID vaccine. Some question is like, is it safe? Are there any side effects? Understand COVID mRNA vaccine, when and where and how to acquire vaccine for people with spinal cord injury, especially and senior citizens. Who get to take the vaccine first? Which vaccine are, as there are many, is the right one to take? Pfizer, Moderna. I know Moderna in California, they stopped using it. I don't know why you still use it in California. And the new one, the Johnson & Johnson, the 1-dose shots, and how the vaccine work. Lots of a question and hope to be addressed tonight. And if not, as I said, Matt will be monitoring the chat room, and they will, if you have any question or concern tonight, I hope all will be answered. We get your email addresses and we'll send you resource links and answer with your concern and questions later. I'm going to jump in for the agenda today. We will have 5 minutes to hear from each other, from our community health worker, Casey Moore, Francisco Elias, and myself. And then I will introduce Jessica. And Jessica will present 10 to 15 minutes, as West said. And also, I have a short notice. I know that Don Mautner is the MED, a senior health advisor from Oregon Health Authority. Thank you for joining us. She will explain how vaccine works and that they are safe to take. Thank you, Don, for joining. Then we will be open the mic for QA and to the reminder of the event tonight. You can post questions and chat room, use your raise hand feature on Zoom. And finally, we will end up with a short final statement. Well, I will go ahead and let Casey please introduce yourself, our community health worker, and then maybe go Francisco and me. Thank you, everyone.
Hey everyone, my name is Casey Moore. I'm a community health worker for Oregon OSCI, and I'm down here in Southern Oregon, the Medford area. And you know, just glad to be on this and help get the right info out.
Would you like to go ahead? We cannot hear you, I'm muted.
Sorry about that. Hi everyone, my name is Francisco Elias and I'm here in Boring, Oregon, Clackamas County. And I'm also a community health worker for the Oregon Spinal Cord Injury Connection. I mainly work with Hispanic people to connect them with the resources we provide. That's all, thank you.
Thank you, Francisco. Yes, my name is Wardah Soufan. I work as I've been certified recently as a community health worker. I'm an outreach coordinator and community educator for Oregon Spinal Cord Injury. Thank you. And I do serve on many committees and volunteer, such like on Oregon State University outreach. This is a new, just I've been accepted to it for outdoor program, school programs for Oregon. And I do serve the community, the immigrants and people of colors and spinal cord injuries, and I present the Middle Easterns, especially those who speak Arabic. And let's go and begin our event tonight. We'll start introducing Jessica. Jessica, thank you very much for joining us today. She has a master's degree in public health and currently is a public health director and the local public health administrator for Multnomah County. She works for Multnomah County for nearly 2 decades now, in a wide variety of roles. Jessica first came to the county as a public health educator in 2001 to work on heroin overdose prevention and harm reductions. In 2007, as the bird flu began emerging globally, Jessica began coordinating with culturally specific community-based organizations and state, local organizations on a strategic plan for how regions would respond to influenza pandemic. because of the time is short, we would like to get Jessica, and the mic is yours, Jessica. Please go ahead.
Great, thank you so much. It's a pleasure. First of all, can you all hear me okay? Okay, had intermittent issues with electronics and internet, so hopefully things will go well tonight. It's a pleasure to be with you all this evening. Thank you so much for the invitation to be here. I have, some overview information related to the COVID-19 vaccine. And I think we just decided in the last minute that Dawn is going to jump in intermittently as we walk through these slides. So Dawn, please jump in wherever you want to share information. And I think, yes, we have the slides up. Do we have the slides up? No, I'm looking at.
1 second. Screen. Okay. Can you see the slides?
Not yet.
I see a name.
Come on. Screen. Caitlin. It's not working.
Okay.
I'm totally fine walking through it without the slides. We just talk through it. Does that seem okay?
We'll keep, yeah,
Good.
that sounds great. We'll keep fiddling with it and we'll probably figure it out here in a second.
I hate PowerPoint anyway, so I'm much better with conversational presentations anyway. So we can go ahead, and then if we get those up, it's fine. If not, it's fine too. Oh, there it is.
Oh, okay.
Good job.
Okay. All right. All right, there we go.
Great. Next slide. So just a couple general statements about our vaccine goals for Multnomah County Public Health. It probably is semi-obvious, but it's worth saying that one of our roles is to ensure the safety and effectiveness of the vaccine as it rolls out into the community. Our broader goals with the vaccine really focus on the hope that we will be able to reduce transmission and morbidity and mortality related to COVID-19. An additional goal in our vaccine work is to minimize the disruption to society and the economy, including maintaining healthcare capacity. And probably our largest goal for Multnomah County Public Health is really to ensure that we have an equity-based system and partnerships in place to look at who is most impacted by COVID-19 and make sure that there are not gaps in access to both information, but also the vaccine itself. Next slide. So in Multnomah County, this is a snapshot from a website that OHA maintains with county by county numbers of how much vaccine we're getting out. So Multnomah County is getting close to the 100,000 mark between first and second doses for our county population. So I will say that the rollout has been a little bit rocky, as I'm sure you all have noticed in the news. We were really lacking a national strategy for dissemination of vaccine and mobilization of vaccine clinics. We're catching up as fast as we can, but I will say that we got off to a rocky start. It feels like it's starting to even out a bit, but like I said, it was a little bit rough for a while there. Next slide. So where we are in terms of the phases of groups that we're vaccinating for the metro area, we have obviously the largest population center between Washington, Clackamas, and Multnomah County. So for us to move through these first phases is quite an effort. And we're doing this in partnership with not only hospitals and healthcare systems, but community-based agencies But these are the groups that we are still moving through, and it's going to take us several weeks to continue moving through these groups. So the first group includes the 1A group, which is healthcare workers, congregate settings, some law enforcement. This is a very large group that we're still seeing people needing vaccination. So that is the first group. The second group that has come out in 1 week waves that we are getting closer to finishing includes educators, any school staff that are essential to reopening schools, and childcare. So again, this is a very large group of people that the governor prioritized above other groups that we're going to talk about. And then we have been rolling out the age bands over the last 2 weeks, beginning with 85 and older. And for the next 2 weeks, we're in the second week of the age bands. For the next 2 weeks, we'll be rolling out in additional 5-year increments till we hit 65 years of age. So all of these people together are thousands, hundreds of thousands of people that we're still moving through. And just because you're eligible for a vaccine doesn't mean that we actually have enough vaccine to reach all these groups. So I know it's been very frustrating for people to try and get appointments, particularly with the large vaccination sites, because we don't have enough vaccine yet to actually vaccinate everybody in these groups. Next slide. So this is a terrible slide, and I apologize on behalf of all health educators I'm offending right now with this slide, but I did want to share an overview of what the Vaccine Advisory Committee from the state has recommended as the next set of people that would be vaccinated. I know that the Oregon Health Authority has to do a little bit more refining of what specifically are in these groups, but these are the recommendations from a very robust community advisory group for the next several groups of folks that will come forward for vaccination. And the strategy here has been really taking a racial equity lens at looking at those most impacted and then breaking them out by different groups based on our epidemiology and community wisdom. So again, OHA is going to be doing a little bit more refining of what these groups actually mean. And then we'll be implementing this at a local level as soon as we continue moving through the age bands and the other groups that I just mentioned. Next slide. So actually, I'm going to invite Dawn in to actually see if she wants to talk a little bit about the vaccine development timeline. I think this is an area folks had questions about in terms of the speed of the development of the different vaccines that have been available. Dawn, is that fair?
You bet. This is right up my alley. Thank you for the beautiful slide. So we know that there are a lot of people in the community who have really good reason to question whether the government's approach to what's in a community's best interest is actually in their best interest, especially Black, Indigenous, and communities of color have good reason not necessarily to trust. And so we recognize the concerns about that and are here to answer questions with the information that we have. And my commitment to you is that as a doctor, I'm a primary care doctor, and I also am serving as a lead senior health advisor for OHA on vaccine, and also I serve as the Medicaid medical director for the state of Oregon. And I will commit to you here to tell you what we know. I'll also tell you what we don't know, because that's how trust can begin to happen, I hope. So we know that when COVID struck last year in the earlier 2020, that the race began to develop the vaccine. All scientists across the globe were working on it. And instead of working in sequence and doing the steps of vaccine development one after the next, they were able to do multiple threads of the work at the same time. This is a more expensive way to do it, and they don't usually do it that way, but they did it this way because it was the sooner the better. And a huge trials with a lot of people, including considerable representation from Black, Indigenous, and people of color within those trials, helped to provide the safety data that have been used to get emergency use authorization, or EUA approval, from the United States Food and Drug Administration, FDA, so that those vaccines are now available. They started early, they were given a lot of money to do it, and as it says on the slide, the studies overlapped. Red tape was pulled out of the way by the Trump administration. And so these companies who had a really important stake in a lot of this work had all the resources they needed to do the safety testing that needed to happen to get emergency use authorization. Now a lot of people have got these vaccines, and we continue to monitor, and the proportion of people who have scary side effects is still pretty small, because imagine the numbers of millions of people who are getting the vaccine. So the numbers we're seeing are pretty amazing in terms of whether these vaccines are good, especially when you compare them to other vaccines that we use on a regular basis. So we'll talk more about this a little bit later, but they are coming through as very, very safe and very effective. And the opportunity to get it first is not only for Black, Indigenous, and people of color, but you can see that that people with whatever kind of privilege they're able to invest in getting this are working really hard to get the vaccine in their own arms. So it's not like when we are targeting outreach and support to communities that have good reason to question the government. It's not like we're trying to see something imposed. It's an opportunity that we're making available to them. They seem to be quite safe, and they seem to be quite effective. We are still definitely waiting for additional evidence, and we can talk more about that. Jessica, back to you.
Yeah, next slide. And this hits on one of the points that Dawn made in terms of the representation in the vaccine studies that have been underway. So this is just from the Pfizer vaccine studies, and shows the level of representation in their trials that is vastly different from other vaccination trials. That gives us confidence in what we're seeing in terms of the efficacy and any of the side effects, and understanding all of that in terms of this particular vaccine. Moderna has a slightly different percentage of representation from BIPOC communities within their vaccine studies. But again, I would hazard to say it's a much stronger representation than we've seen in previous vaccine studies, really addressing what Dawn mentioned in terms of well-founded distrust. And as a matter of fact, I'm sure I don't need to tell folks on this call, but public health itself has perpetrated harm against BIPOC communities. So really understanding that it's important that we delve into these issues, both in terms of talking about it, but also ensuring that there's representation in the vaccine studies. Next slide. So I will talk in a very layman's way about how the vaccines work. And again, I invite Dawn to I'm not a doctor, by the way, to jump in and talk a little bit about the basic mechanics of the COVID-19 vaccine. So just in my understanding, and very much a layman's terms for me, which is important, is the vaccine technology that has been developed for the COVID-19 mRNA vaccines utilize our body's systems to recognize and fight the coronavirus that causes COVID-19. So Dawn, I don't know if you want to talk a little bit more about that as well.
Sure. One of the questions that I field a lot is, why do people respond so much more strongly to the second dose with side effects, the feeling of being ill, the feeling of fever and muscle aches and all of these different things? And the answer is, with the first vaccine, the first dose, your body is taught how to recognize and respond to the elements of the virus that are contained in those itty bitty pieces, the mRNA. mRNA is not DNA, and it can't do things to the DNA of your body in a way that can affect things like reproduction, that kind of thing. It's mRNA, it's a different molecule than DNA. But because it has taught your body how to recognize it, when you get that second dose of those little bitty pieces of mRNA, your body recognizes it. And the inflammatory processes that your body's immune system uses to fight off viral infections flare. And that's why we're getting more of the symptoms with the second dose. That's called priming. Your body has been primed by that primary dose of vaccine. And when you respond to that second dose, it means it's working. Your immune system is working. So that while it's not comfortable and it's not very much fun to go through those, it means that if you should become exposed to the virus itself out in the world, including hopefully some of the variants, your body will know how to fight it off. And that's a good thing. What they don't do is impact your body's ability to reproduce your own DNA and to continue with its normal functions with changes to your own genetic code. It's not like that. It activates your immune system.
And I would, sorry.
Go ahead, please.
I would just add that a lot of people ask about specific ingredients in the Pfizer and Moderna vaccines, particularly around pork products, eggs, and latex. And neither of these vaccines contain those products. So I'm asked a lot about the ingredients within the vaccines.
Thank you.
Next slide. So I think as we both mentioned, this is all real-time unfolding public health work as we move through vaccinating the community. And we obviously have ongoing studies to understand the efficacy of the vaccines, any side effects, and any of the issues around the variants that Dawn mentioned. So our data to date, as I'm sure you all have heard, have shown that the vaccines are very safe and effective, upwards of 95% effective, especially in reducing severe illness, hospitalization, and death. So we really understand and know that for folks that get the vaccine, it categorically reduces those risks, which is a really important element. Things that we're still learning as we continue to understand the vaccine and the virus itself, how long the protection from the vaccine will last, how much or if at all vaccinated people could still spread the disease to others. That's still not entirely understood. Will changes in the virus mean new vaccines need to be developed in coming years? There's a lot of discussion right now in public health and medical circles around, we're probably looking at a situation that's going to be with us for a very long time and likely will need an approach not unlike influenza, where we have a virus that's updated and needed over time. And then, just learning about side effects or rare side effects as we really start to vaccinate millions and millions of people. The trials, while they were large and we did understand some of the side effects, undoubtedly, when you vaccinate millions and millions of people, you're going to see additional issues that you might not have seen in the original trials. That doesn't give us any doubt that we support the efficacy and safety of these vaccines, but we can expect that some of those incidents, adverse reactions will happen as we vaccinate more people. Next slide. And then, a little bit about the side effects as we understand them right now. I was just talking to a bunch of folks that were at one of our second dose vaccine clinics today at our McCoy building, where just a slight tangent, our electricity went out in our main building where we have our vaccine freezers. You can imagine the minor breakdown I had today when I realized that we had to scramble to figure that out. Everything is fine. The vaccines are fine. But I was down there to visit a clinic that we were holding in the lobby of the McCoy building and talking to folks. They were getting their second dose and listening to folks about, what their kind of family members and other people they knew that were getting vaccine, what they were seeing. And a lot of what I've been hearing qualitatively is side effects after the second dose, more commonly than the first dose. But these are the general side effects that we've been seeing: soreness or redness where at the vaccination site, low level headaches, tiredness, and perhaps a low fever, but generally after the second dose. Again, qualitatively of the folks that I work with and know that have gotten it, there's only been 1 or 2 folks that had to take a day or 2 off, just kind of felt under the weather after their second dose. Of course, there are the rare side effects, the severe allergic reaction that we do our best to screen for in terms of folks having a previous anaphylactic event. When you come to get vaccinated, you will be asked to wait 15 minutes after the vaccination so that we can observe folks. We're required to have a medical response team pretty much on hand in the event of an adverse reaction so that we can respond quickly. Luckily, I am not aware of any of the vaccine clinics that we've done that we've had the need for that, but we are required to have that on standby. Next slide. Oh, and I think that's generally the gist, and we'll open it up.
Yes, thank you very much, Jessica and Dan. Appreciate your time. If anybody have a question, please feel free to jump in. My question, I have a question if I don't mind. Either one of you can answer it. Moderna vaccine, I heard they stopped using it in California, and we still in Oregon are using it. Do you guys know about this, or what did they stop it in California?
I know that I'll tell you what I know. I know that there was a batch of Moderna vaccine that it appeared there was a cluster of adverse events that appeared to be related to a batch of vaccine, but I don't know much more than that in terms of the ongoing use. We have not seen anything in Oregon that has at all given us pause around the overall use of the Moderna vaccine. Dawn, I don't know if there's anything you would.
What you said is consistent with what I know. There was one batch, there was some concern, and after investigation, they resumed using even that batch. So we haven't had any difficulty with the batches of Moderna or Pfizer vaccine. I'm also happy to speak to the Janssen, which is the same as the Johnson & Johnson vaccine when we get to that.
Okay, thank you very much. I think Ines has a question. Go ahead.
Yes, thank you. I had a question regarding the anaphylactic reaction. Is it anaphylactic reaction to previous vaccines or anaphylactic reaction to something that you're allergic to?
Any anaphylactic response to anything will put you onto, make you a person of increased concern for us as providers as we're monitoring. And so you would then go into the group that gets a little bit longer, monitoring if in fact it's decided that you should go ahead and get the dose. It may be a conversation to have with your provider at that time.
Okay, thank you.
Dawn or Jessica, after getting the vaccine, the second dose, would you still be vulnerable to get the virus?
What we know, like I mentioned, is that really where we're seeing the efficacy is in reducing the potential severity of illness, hospitalization, and of course, death. If someone gets vaccinated, it's shown to be highly effective in the people who take the vaccine. I will say, and I was, on a call this afternoon, that I think people were really disappointed to hear me say this, but we're still in an evolving situation, and we're going to need to use overlapping prevention strategies for the foreseeable future. So I don't want to downplay the excitement around the vaccine as one more tool in our public health toolbox, but it's really important right now that even after vaccination, that we continue to practice most of the prevention strategies, including face coverings and masks, physical distancing, and really thinking through social gatherings and things like that for the foreseeable future as we continue to understand more about what's happening. So it's a new tool in the toolbox, and we are still going to need to use those precautions as we move forward.
And just to follow up on that, this vaccine is, the Moderna and Pfizer vaccines are 94.5 to 95% effective against hospitalization, 100% against death, and 100% effective against death. That is, anybody who has gotten these vaccines hasn't died from COVID. That's incredible. And we have seen that even if people do wind up with the illness, that it's mild, and there are going to be, we're calling them breakthrough cases, but at 94, 95%, we're vaccinating tens of thousands, or roughly at 15,000 people a day in Oregon. There's going to be a certain number in that 5% that is expected. So even though we're calling them breakthrough cases, we know they're coming. It's only 95% effective against illness, even though it's 100% effective against these severe outcomes, hospitalization and death. So we also know that the variants are here. We don't know the effectiveness of these vaccines against those variants. Those really high numbers of efficacy, are in a testing environment that didn't include those variants. So to bring up the Johnson & Johnson vaccine, which is the same as the Janssen vaccine, the one-shot dose, the one that only requires refrigeration, so it's much easier to administer. That vaccine has what appears to be a lower efficacy of 67 or 77%, depending on where you're looking. However, it is being tested in an environment that includes those new variants. So even if it has a little bit lower efficacy, it's still very, very good. And we don't actually know the efficacy of these Pfizer and Moderna vaccines in the testing in the environment that has the new variants. So that it may actually be a lower efficacy in that way. We'll have to see. That evidence is still rolling in. They're all really good vaccines. The best vaccine is the one you can get, is how we're saying it. There aren't the kinds of side effects that make these anything like as risky as COVID itself. It's not a what's the risk of the vaccine versus nothing. It's a risk of the vaccine versus the risk of COVID and what it's doing to our families and communities. So that's what we weigh when we decide to get vaccinated, to get our families vaccinated as best we can.
Thank you very much. I really appreciate it. West, have a question?
Yeah, thank you, thank you, Jessica and Dawn. The presentation is just very helpful. And I'm really grateful for your time to just field questions. I want to pivot the conversation specifically towards the disabilities communities in Oregon, and share some of the concern and feedback that we've heard about not only being exposed and the risks of exposure to COVID, but also the barriers, kind of the systemic and structural barriers that many of our members and even members of other disabilities communities are experiencing trying to access the vaccine. And I guess my underlying question, and I'll say a few more things, but my underlying question is, what have you observed in the logistical rollout of distributing the vaccine that is helping people with disabilities access the vaccine in a safe way. Yeah, because some of the listening sessions we've hosted, it's a little bit overwhelming about how what's the right word, like deflated people have felt trying to navigate the system, electronic system, trying to navigate transportation, trying to find, people that can come alongside them and assist them to a public place, or if they don't have a car, trying to get, going to the airport so there are all of these, there are layers and layers of barriers that it feels overwhelming. And going back to my question, I know this is a learning experience for all of us, including this partnership that our community-based organization has with Oregon Health Authority and with the local public health authorities. But how has OHA and Multnomah, Multnomah Public Health Department learned or evolved in this rollout, specifically in regards to serving our communities with disabilities? And I will just let either of you decide which one like to go first. It's a loaded question.
I mean, yeah, I can speak from the local level because I tried to sort of go touch on that a bit when I started talking. I mean, that's what that is part of what I was referring to in the Rocky rollout, right? So the beginning phases, with the large vaccination sites, although we're grateful, obviously, to be partnering with healthcare systems and hospitals to have these high throughput sites, it doesn't work for a lot of people. And we knew that going in, and we knew that local public health would have to plan for multiple variations of much smaller closed pods with all the wraparound supports that you're talking about. So that's what we're rolling into and have been for the last couple of months. And unfortunately, one component of that, I will say, is understanding that, we have a scarce resource situation right now where we are seeing folks that do have sort of unfettered access to a scarce resource and a way to get it at these large sites that has been, fairly exclusive. So we, know that plays out. Systems are built for a purpose, and the system will serve people that it is meant to serve. So we have to have alternative solutions to addressing where some of these barriers are that you're talking about, West. And like I said, in Multnomah County, what we quickly started pivoting to were closed pods in partnership with community-based agencies that include multiple levels of direct connection, starting with ensuring that, folks have someone that they can call to actually register for a vaccine, all the way up to arranging for transportation, ensuring that there's wraparound supports available at our closed pods that are trusted leaders in the community, doing sessions like this in advance of vaccination clinics to make sure we're not making any assumptions about people's desire to get vaccinated. I'm not here to sell you anything. I'm here to answer questions so that people can work through a decision for themselves. So really doing all of that work in partnership and standing up what I'm sort of referring to as closed pods. So right now, what we're doing within those phases of groups that are eligible, we're doing much smaller vaccination pods that are very, very targeted and in partnership with community groups, and doing a separate sign up so that we don't have the issues of the slots, sadly, getting overrun by people who have an opportunity elsewhere where they have kind of that unfettered access. So that's the path that we're going to be taking, which means much smaller vaccination sites in complement to the larger ones. I happen to be going to a meeting tomorrow with the hospital systems to talk about this very issue, to close the gap, because it doesn't, we don't need an either or situation. We need a both and we need lots of iterations of places that people can access vaccine at. That includes pharmacies, FQHCs, public health sites, the hospitals, And we're slowly getting to that place, but we're going to bring all of our learnings to that conversation tomorrow, because exactly what you're talking about is those are the barriers that we're seeing for people.
Thank you, Jessica. My question is, I know I get the VAC application, VAC, to be on the committee, and I applied, and I tried to let people with disability to be on the committee as well. So those barriers can be really dropped down and make it easy process. I wonder if you guys have any people with disability on that committee, or if you know any.
John, I don't know if you can speak to the membership of the VAC.
I don't know it off the top of my head, but I can pull that up pretty quickly here in a minute. I know that the concerns about access are critical concerns. We are doing a lot of listening and trying to be responsive. Community knows what community needs. That includes the disability community and lots of other highly impacted communities. So if we listen and target resources in the way that we are told resources need to be targeted, then we can allow community-based organizations such as this one to, one, tell us what kind of support is needed, and two, provide the care and the support and the outreach in the ways that that particular community needs. So that can be culturally responsive in the disability community, in any of the other highly impacted, potentially more vulnerable communities, individuals, families. The Vaccine Advisory Committee has provided us with those kinds of, with that thoughtful input, and I will pull up the membership to see how the disability community is represented there. I do know that they had over 500, maybe even over 600 applications for something that wound up being 40 people or something along those lines. There was a huge interest. And that's one of the beauties about doing this work, that we are able to do that listening. And ever since the beginning of the pandemic, we came at it and tried to do a good job of it and didn't get it right. So we opened up the phone lines and took input from the community and iterated to make it better, try to make testing events available, try to get out into the clinics where people want to get their care and not make people come to us, provide transportation support, et cetera. Keep iterating and trying to make it better, knowing that we're going to get it wrong. We're going to get it wrong. The question is, can we keep getting it righter by following the community's lead? And we're trying to do that.
Thank you very much, Jessica. Anybody else would like to say anything? All the question chats, no question, do not.
Looks like Bob has a question.
Go ahead, Bob.
Yes, quick question. I'm not from the Oregon area, but a question related to getting vaccine for the people with disabilities. I'm in Florida, and right now we're not on the list for getting a vaccine anytime soon. I just wondered if there's any national plan to help people with disabilities to be able to get moved up on the list to get vaccines. I'm not over 65. I am not a healthcare worker. So I won't, in the next group or the following group down below, it does not look like, and there's 21 million people in Florida. A lot of people are over 65. So for someone like myself, who's only 60 years old, and I'm not a healthcare worker, it's not going to be, I'm not going to be on the list anytime soon. If anybody knows of any tips or any ideas for someone like me to get moved up, for people with disabilities in Florida to be able to move moved up on the list. Thank you.
You may need to try, you may need to take a ticket and come to Oregon. No, I'm joking. I don't know much. I don't know if anybody can add to this one. I don't know what's the laws and the public health regulations in Florida. Anybody, any thoughts?
I know that each state, has the ability to interpret sort of the CDC guidance regarding vaccination recommendations sort of state by state. So there isn't there's like national guidance, but each state, as you can see, right, because it's a patchwork, really hard to make sense of from state to state. I don't know of any national advocacy efforts, but I'd be willing to bet that there is something out there. I'd be happy to dig around and look. There's certainly other advocacy groups that have made a strong case for shifting vaccination priorities. We've seen that in Oregon. Multnomah County was part of an effort to ensure that adults in incarceration settings were moved up, because we absolutely unequivocally know unfortunately from our outbreaks that that's a population that's at high risk that wasn't originally prioritized in the Oregon framework, but we and other folks advocated, and some people sued to ensure that adults in custody were moved up the list. So it's not unprecedented that advocacy can work, but I'd be happy to look around and talk to a couple folks that I know about any national advocacy efforts that might be relevant.
Great, thank you very much.
Bob, I might add, you might reach out to, I'm not sure if you've heard of Disability Rights Florida. Every state has a disability rights agency. Ours is called Disability Rights Oregon. You might consider reaching out to them to learn what they're doing, because surely they're advocating for the disability community. But there's also University of Florida has a disability center, and they have a lot of connections with the public health department as well. And so it's not an easy answer, but there is advocacy efforts happening in Florida. And those, I would recommend, those are two agencies that you could probably reach out to that are closer to you, that might have better answers than we have here in Oregon. But thank you for tuning in and joining us.
Yes, thank you. Thank you, everyone. I'm sure a lot of other people have the same question around the country, different states. And some states are doing better than others. So thank you.
Thank you, Bob. I have a question, Don. Go ahead. You want to say something, Don? Go ahead.
Well, I just wanted to address that really critical question from Mr. Grasso that is, there's this tension between getting shots in arms as fast as we can and success being measured in numbers of shots in arms. That is in direct tension against the more careful, targeted outreach to reach, for example, individuals with disabilities. It requires, we owe communities that kind of targeted outreach, but it's not as fast as having the convention center or drive through shooting up arms as fast as whoever can get there. And so the dynamic that says the states that get the most shots in arms the fastest are going to get more vaccine at the expense of states that do it more slowly, puts the government and the local government, state government, in a very difficult position, because their job is to get everybody vaccinated. But if the resource that's already scarce is going to get more scarce, if we are slower about distributing the vaccine that we have, which is what's needed to get to the communities that need it most, they're in an impossible position, right? Because we want to be picking and choosing in order to make sure that the people who need it most and ought to be first are getting it first. And yet that's a hard place to make that decision. And Mr. Grasso, I think you're probably suffering with that in the same way a lot of people all over the country, and including in Oregon, are struggling with it. So thank you for raising the question.
Thank you. Well, I have a question, very quick one. I know I stopped traveling because of COVID-19 overseas, which is really, I haven't seen my family for almost 2 years now. And I wonder if taking the vaccine, that will let you bypass that quarantine, and especially in Europe and back home in Middle East. Do you guys any info about maybe vaccine will give you a free pass? You don't have to be quarantined.
Local jurisdictions make that make that call, and it's not, I don't know the answer for Europe, and my guess is that it changes by locality. But the question of whether to quarantine after a vaccine is one that's, it's not a clear-cut answer, because when we don't have really good, although we have reason to believe that vaccine disrupts transmission, we don't have good evidence about it. So we can't say that it does, in which case you may wait in an airport, acquire the disease, not have symptoms, get on a plane, take it home to your family elders. And that's not the gift that you're wanting to give them after you travel to see them for the first time in a year. So the decision about whether and how to implement quarantine around vaccine is one that still lacks data for a definitive answer.
Thank you.
I have a question.
Well, go ahead, Casey.
So as a community health worker, and when people reach out, right now is the local public health by county the best way to recommend people reaching out and looking at where they can be vaccinated if they're eligible?
I would say so. Both the state and county have websites and different information access points, but because each county is doing, like I was describing what Multnomah County is doing for really kind of smaller community-based pods, each county is doing something slightly different. I will say in the metro area, we work very closely together. So Clackamas, Washington, and Multnomah County, we're on the phone every day sorting through kind of what our approach is going to be and where we can have shared approaches. But I think probably at the county level is the best place to start. We're always linking to the state information, and we have the same sort of eligibility screening mechanisms, but that way you can kind of find out what's happening directly in your county. And I in the chat box about 15 or 20 minutes ago, I linked to some information pages from Multnomah County that has some really nice one-pagers that our communications team put together in multiple languages that might be of use, especially to community health workers.
Okay, thank you.
Yeah, I found it very beneficial, to outreach and convey those messages to people of colors and people, communities who don't speak the language and don't have access, or they don't know where to go. As a community health worker, I think, reading online and getting the resources and hearing from people like you is very important. Thank you. I guess, go ahead.
Sorry, Wada.
No
I agree with Jessica that the local resources are more likely to be specific to your situation. I did put the OHA and state level link in the chat. There's a huge amount of material there, information, but I do also want to say, even though the mass vaccination sites are not designed specifically to target mobility impaired, hearing impaired, other kinds of populations that may have very specific needs, they have been making tweaks all the way along. So for example, at the Salem Fairgrounds where I visited last week, they learned that there are people who can't wait in line for a long time. So there's a separate short wait line, and you come in the side door, there's a separate waiting area for elders, for people in wheelchairs, mobility impaired. And there's a navigator, a wayfinder person who comes out to meet you as you park or as you come in the van or whatever, help you figure out at a couple different screening points on your way in to the fairgrounds, which is also on transportation lines. That's part of why they chose it. They help you figure out where to go. So one side has one specific entrance, short walk, short wait time, separate waiting area, caregivers can go, and then a short walk to the vaccinating area and a short walk out. There's another place where people with ID or DD challenges can come in, get a higher sort of staff ratio to get the additional support that they need, a cordoned off, curtained off area for additional privacy as needed, additional kinds of interpretation. There's an on-site interpreter, both for Spanish, and they get an on-site interpreter for ASL, and they have video and phone interpreters for other languages as needed, even though it's not perfect. And even though it isn't designed for outreach to those communities that may have special needs, the they're trying to tweak to make themselves accessible in all the ways that they're informed it needs to be more accessible. And that's where organizations like this one come in, tell us what is needed so that we can get better at what we're trying to do, make the vaccine accessible to the people who should be getting it right now.
Thank you very much. Go ahead.
Hi.
Hi. Thank you, everybody. I think, it's time 6:30 and we wrap up. Final statement, we at Oregon Spinal Cord Injury, we are determined to help and improve our community's health. And on behalf of Oregon Spinal Cord Injury, we thank you very much for participating, Jessica and Dan. And thank you for being available and addressing us and the participants. Hope you all and your beloved one to stay healthy and safe during this pandemic. Please let us know if we could be more of help. Have a good one.
Bye.
Can I say goodbye to everybody?
Bye. Thank you so much.
Bye-bye. Thank you.
Thank you, guys.
Muchísimas
Yeah.
gracias.
Hey, Matt, can you stay on? We're gonna.
You guys gonna stay? Okay. Hi. Probably, yes.
Later, guys.
Bye, dude. I'm gonna stop recording. I think I'm gonna stop recording.